What are the best acute treatments for chronic migraine? Imagine waking up with a pounding headache that just won't go away. If you experience this often, you might have a condition called chronic migraine. It's a type of headache that happens 15 or more days a month, with at least 8 of those days involving migraine symptoms. Managing these headaches can be tricky, but knowing your options for quick relief is key. When a migraine strikes, the goal is to stop or lessen the pain and symptoms as fast as possible. The first line of defense usually involves over-the-counter pain relievers. Common options include ibuprofen, aspirin, and acetaminophen. These can be effective if taken early, ideally when the pain is still mild. They help reduce headache intensity and can also ease associated symptoms like nausea or light sensitivity. For more targeted relief, doctors often recommend migraine-specific medications. The most common are triptans, which are considered the primary choice for moderate to severe migraines. Triptans work by constricting blood vessels and blocking pain signals in the brain. They work best when taken right at the start of a headache. Examples include sumatriptan and rizatriptan, which come in tablets, nasal sprays, or injections. The typical dose is 1 tablet or spray at the first sign of pain, and if needed, a second dose can be taken after 2 hours. It's important not to exceed the maximum daily dose, which varies by medication. Another class of medications includes ergotamines and ergot alkaloids, like dihydroergotamine. These are less common now because they can cause side effects like nausea or muscle pain, but they are still options for some patients. They are usually taken in nasal spray or injection form. More recent options include gepants and ditans. Gepants, such as ubrogepant and rimegepant, target migraine pathways without constricting blood vessels, making them safer for people with cardiovascular issues. Ditans, like lasmiditan, also act on migraine pathways and are useful if triptans are not tolerated or contraindicated. In addition to medications, some non-drug devices have received approval for acute treatment. These include neuromodulation devices that send electrical or magnetic signals to nerves involved in migraines. For example, devices that stimulate the occipital or trigeminal nerves can reduce pain without medication. Single-pulse transcranial magnetic stimulation uses electromagnetic fields to calm overactive brain nerves linked to migraine. These devices are portable, easy to use, and can be a good option for those who prefer non-drug treatments or need quick relief. Using these treatments effectively involves taking medications as early as possible during an attack. The sooner you treat a migraine, the more likely it is to be less severe. It's also important to tailor your approach, as different people respond differently. Some may find triptans work best, while others prefer neuromodulation devices or newer drugs. Always discuss your options with a healthcare provider to develop a plan suited to your needs. Avoiding overuse of acute medications is also vital. Taking too many can lead to medication overuse headaches, which can make chronic migraines worse. Combining medication use with lifestyle changes, such as regular sleep, hydration, and stress management, can help reduce the frequency and severity of attacks. In summary, the best acute treatments for chronic migraine include early use of simple painkillers, targeted migraine-specific drugs like triptans, newer options such as gepants and ditans, and innovative neuromodulation devices. Choosing the right combination depends on your attack severity, health status, and how you respond to different treatments. Working closely with your doctor can help you find the most effective and safe way to manage your migraines quickly and effectively.